Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Hey everyone, welcome to the She Found Motherhood podcast. So we've had some of our followers ask us to include more breastfeeding information and resources, so we thought we'd touch on the very common complication of breastfeeding known as mastitis. So today, we're providing an overview of the updated Academy of Breastfeeding Medicine Clinical Protocol number 36. Now, this is hot off the press. So if you've had mastitis in the past, you would have gotten very different information about how to manage it. Almost the exact opposite of what we're recommending today. So back then, our understanding was very different than what it is today. So just know your provider wasn't wrong. You didn't do anything wrong. Our knowledge and the evidence has just changed our practice. In fact, in preparing for this podcast, we were both learning about these updates for the very first time.
Yeah, I was just saying to Sarah as I was reading, she prepped the podcast, and I was like, whoa, I've been doing this wrong.
I know.
For so long.
I know.
It's
we
Alicia
basically
here.
told people the exact opposite.
Yeah, correct. Anyway, so this is the reason we do this, is because we continually learn new things, and it's
pretty
great.
Cool.
And also we just want to recognize, and in the interest of language, we recognize that some people like different terms. So chest feeding, nursing, body feeding, breastfeeding, they're all correct terms. We can use them interchangeably, and some people have preferences for whatever reason of one over the other, and we want to be respectful of that. So we will be using different terminology throughout the podcast in an effort to be inclusive and respectful of people who prefer different language for whatever reason. And just remembering that our resources are made to be for general information. And so we're trying to make sure that we're getting the information that is important across in a way that is kind and respectful to all people who are choosing to feed their babies in whatever way works for them. Yes. So we're going to get into the meat of the tissue of mastitis.
Of the mammary tissue.
The mammary tissue.
Yeah. So we'll start with the basics. What is mastitis? So simply put, mastitis is considered a spectrum, so a range that starts with inflammation and swelling of the duct. It can, but does not always, progress to an infectious component, which requires antibiotic therapy. And we'll get into the nitty-gritty around this in a little bit.
So when it comes to mastitis, it's really important to know what might put an individual at a greater risk of getting it. And some of these risk factors include hyperlactation, or what's commonly referred to as an oversupply. Additional factors that can increase your risk include something called mammary dysbiosis,
a fancy one,
otherwise described as disruption of the milk microbiome. This results from a complex interplay of multiple things, including genetics of the feeding parent, underlying medical conditions, exposure to antibiotics, use of probiotics, regular use of breast pumps, and a history of cesarean birth. Another factor that can also increase the risk of mastitis is people who either bind their breast or chests. So making sure that you have appropriate fitting bras or binding materials around your chest, and making sure they're a little bit more loose than you would if you were not lactating.
So it's basically thought that all those different complicated factors that Alicia mentioned above, which we call risk factors, so they increase your likelihood, contribute to the development of mastitis. And again, mastitis is inflammation and swelling in the breast or the mammary tissue. It's not necessarily infection. And a really important clarification to understand is that mastitis is separate from engorgement. So many of you, if you've previously been pregnant, given birth, afterwards, we typically see engorgement in the breast and mammary tissues that's typically seen between postpartum days 3 to 5. And sometimes, I didn't even realize this, but it can be actually upwards of 8 to 9 days postpartum. in the first time breastfeeding or chest feeding parent. Now, engorgement symptoms may be similar to those of early mastitis, but it's actually caused by lactogenesis 2, which is that sort of secretory activation in those mammary and in that breast tissue. And the really important clarification is that engorgement typically presents bilateral, meaning both breasts, and people experience pain, firmness, and swelling that is typically self-limited, meaning that it goes away on its own and responds to conservative treatment, which typically include like a well-fitting bra. You can use a bit of ice, taking anti-inflammatories, and it typically does not progress to mastitis.
Now, can we use the cabbage leaves still?
Yeah.
Is that still okay with our new guidelines?
Yes, as far as
Perfect.
I am aware.
Green cabbage leaves.
It's really cool. And you guys, there's actually evidence around it. There's some kind of like interaction between what's in the leaf and the breast tissue. It's very fascinating.
Very cool. For engorgement.
Yes. And we have a lot of posts around that. So go scroll our social media.
Yeah, totally. So the first stage of mastitis is typically described as ductal narrowing. So this is caused by inflammation at the ductal level. So that's the area that leads the mammary tissue out to the nipple, that
Like
kind
the
of
tubes.
the
kind of.
tubes, yeah,
Right,
the tubes that the milk flows through to get out of the nipple. So it leads to a narrowing of the duct. Clinically, for the person, this presents as a smaller area or localized area of breast tissue that is firm, tender, and often a little bit red, or erythematous, as we refer to it, but without any symptoms from a whole body perspective. So those symptoms would typically be fever and chills. So those aren't involved in that kind of early stage. What's important to understand that this isn't actually a plug, which is a bit counterintuitive. That's what we've always thought. You get some milk in there and it dries up and it causes a plug. That's what we used to call plugged duct. But rather, it's the actual ductal tissue that's getting inflamed and irritated and therefore blocking the passage for the milk to get out. So this is a really important distinction to be made because you can't squeeze inflammation out.
No.
So we used to say, well, try to massage it to squeeze the plug out. But if it's inflammation, doing that isn't going to do you any good. And it's really quite uncomfortable and painful. So this is one of the new kind of theories and thoughts. So attempting to massage or offer extra feedings from the affected breast can actually make it worse by damaging the tissue that's already inflamed and irritated and increasing the milk production on that side, which is then going to be there's more milk blocked up there. It's going to be more uncomfortable and painful.
So the exact opposite of what we used to tell people.
Correct.
So if ductal or tube narrowing persists or gets worse, the inflammation progresses, and then you typically go on to experience what we would now call inflammatory mastitis. And so typically this would present as that breast becoming increasingly red, more swollen, and really painful. So it's really important to understand at this point and that it's simply an inflammatory response. And you can sometimes, and this is where it gets complicated and where your provider should get involved, is that you actually go on to experience what we call systemic or whole body symptoms like fever, chills, and even a bit of an elevated heart rate. And this is just your whole body actually responding to inflammation. And this can happen without infection. So this can be really hard. And we probably in the past have over-treated with antibiotics. And so just understanding that the next step, so Alicia said initially, it's just you're having that pain, that swelling, that redness without the systemic symptoms. And then if you go on to get inflammatory mastitis, you may have those systemic or whole body symptoms, but still there may not be an infection there.
Yeah. Like Sarah said, you can get that inflammatory reaction of your body, but doesn't necessarily progress to become infectious, meaning that the inflammatory tissues have now been infected with bacteria requiring antibiotic treatment. So there are a few additional complications, including a phlegmon.
Oh, that's a terrible word, isn't it?
And an abscess, but we won't go into details because although it can happen, it's less common that we go on to progress to that. So now understanding that there are three different entities that we're talking about: ductal narrowing, inflammatory mastitis, and infectious mastitis. Let's move on to talk about what can we actually do about it, i.e. treatment.
Yeah. So one of the most important messages that you probably already figured out here is that mastitis, regardless of the cause, even if it's bacterial, actually does not cause a risk to the infant. And you can continue to safely feed your baby on both the affected breast as well as the unaffected breast, or use pumped milk. And that most people's symptoms will resolve with simple measures, which we'll outline below. And so it's just really important to understand that it's safe for you and safe for your baby. And another key message is that systemic symptoms, so those whole body symptoms like fever, hot flashes, elevated heart rate, can occur in the early postpartum days and don't necessarily mean you have mastitis. So it's complicated. We encourage you to connect with your care provider if and when you're experiencing any of this.
So what should we do if we've got symptoms of ductal narrowing or of the inflammatory mastitis? So we're not talking about the infectious, but the ductal narrowing or the inflammatory mastitis. So number one, feed on demand on the affected side, and don't feed to empty though. So overfeeding, remember how kind of milk is produced? It's a supply and demand type situation. So if we overfeed from the affected side or pump until empty, it perpetuates that cycle of increasing the amount of milk or hyperlactation that can actually lead to worsening inflammation. So in fact, starting feeds on the unaffected side, as that can help decrease the amount of milk production on the affected side, can be helpful during this time. Now, if it's too painful, hand express little bits. If you can't feed because it hurts too much, hand express little bits, small volumes just for comfort, but don't try to put the pump on and pump that breast empty. Also, we've mentioned it before and we'll say it again. Make sure you're wearing an appropriately fitting bra or chest binder for support. If it's too tight, it's going to perpetuate the issue. Avoid breast massage. Now, this is a big one because we always used to say, get in the shower, massage the breast, get that plugged duct unplugged. Remember, it's not a plugged duct. It's inflammation. And if you're going to be massaging it, you're actually going to be putting more pressure. It's if you have a sprained ankle and then you start pushing on it, you're going to make it worse, right? So don't do that anymore. But how do we decrease the inflammation? Let's go back to that sprained ankle analogy. We rest it, we ice it, we use an anti-inflammatory. Same thing for our breast tissue, ice it, and then ibuprofen would be an anti-inflammatory. And if you can't take that, then acetaminophen or Tylenol would be the other option.
Now, this is really exciting because I'm super woo, and I love the fact that sunflower or soy lecithin, 5 to 10 grams, can actually help with prevention if symptoms are recurring. So the recommendation is taking 10 grams in the acute phase. So when there's actually that active inflammation, that redness, that pain, that swelling. And then you can take 5 grams daily simply to help prevention if symptoms are recurring. I just think it's so cool when we can actually use like natural products with evidence to help support and manage our patients. So sunflower or soy lecithin, there you go. They're, probiotic. It may be useful. We're not 100% sure. So you could consider taking ligilactobacillus fermentum. That was pretty good. Hey, you did really good. Yeah, formerly classified as lactobacillus fermentum, or preferably ligilactobacillus salivarius. We'll type these out in the show notes, which used to be classified as lactobacillus salivarius strain. So the data is a bit limited. There's no evidence of harm. So if you're someone who's super into probiotics, we'll put those two in the show notes below and you could consider picking. Drainage can be used instead of massage. And so what we would recommend in this case is talking to your provider or another health professional about appropriate technique. It is very different than that sort of localized massage. And this is actually pelvic physiotherapists are trained in, and they can help support as well. And then last but not least, this is a really important one. Do not pop bleb, quote unquote bleb. So if you've breastfed before, you probably have experienced a nipple bleb. And so what that is, that actually inflammatory cells from your duct that have made it to the surface and they've gotten stuck. So we do not actually recommend like unroofing or popping it off, as this actually can lead to trauma and further narrowing of that duct. So like we mentioned above, taking oral lecithin, and you can get a prescription for a moderate potency, so medium strength steroid cream that can reduce that inflammation on the surface of the nipple. And just understand and know that steroid cream is safe with breastfeeding. You can wipe off any excess with a damp tissue or towel before feeding your infant. But this would be the recommended treatment for those blebs, not trying to unroof it with a needle or a pin or anything like that.
I've only done that twice in my career so far, but sorry.
Yes, I did it to myself. I know.
You're tough. So the question is, what if I've tried all the above and it's not improving? When do I check in with my provider? So people should really be evaluated by a medical professional if the fever and other systemic symptoms persist for more than 24 hours, despite all of the great suggestions that we have already presented previously on the podcast if they're not working, right? Because we do actually then need to go on to rule out, is it actually become infected? So it's certainly something to chat with your provider about. So if you've had like with fevers and chills and feeling unwell and you've got this area of redness on your breast that is not improving after 24 hours, despite doing all of the things that we've suggested, it's a good idea to check in with your provider, because if it is infectious, then we would need to go on to provide antibiotics.
And I think one more important note that we review before we close is to acknowledge that mastitis and breastfeeding and chest feeding and body challenges as a whole can have a really huge role in postpartum mental health. And I know for me personally, with my first, I had difficulty with breastfeeding. He had a tongue tie, then we had a difficult latch, then I had an oversupply, and it definitely impacted my mental.
Well, make sure to check in with your provider if you're experiencing any kind of breastfeeding or chest feeding difficulties, not only around your physical health, but also around your emotional and mental health. If you've been experiencing changes in your appetite, sleep, other than that's just the newborn phase, intrusive thoughts, and if you want to learn more about that, make sure to check out our podcast on intrusive thoughts, postpartum anxiety that we did with Dr. Pip. It's incredible. If you're having thoughts of harming yourself or your infant, or you're really struggling with your ability to enjoy your baby, please reach out to your provider, because certainly there are ways to support you in your journey. And really, everybody deserves a happy, joyful postpartum experience.
Enjoyable, right? It has its ups and downs, but for the most part, you should be enjoying your baby.
Right.
And so the other most important takeaway is that not all mastitis is infection, meaning not all mastitis needs to be treated with antibiotics. And another additional note that we didn't really get into in much detail, but is if you start to get recurrent mastitis, we really recommend you seek support from a knowledgeable provider, as there could be underlying issues at play like hyperlactation, so oversupply, a problem with the latch, or inadequate treatment of a previous infection that really would warrant more investigation than treatment. And then lastly, just a reminder to check in around your mental health if you have any concerns. Providers are always happy to support you.
Yeah. And then just one little plug for one of our favorite courses. We have done a ton of work with our friends at Happy Healthy Eaters. And now if you are feeding your baby, that probably means that you're starting to think about starting solids. And they have an incredible course on starting solids, all kinds of information, when to start, what to start with, for people from different kind of areas of the world. Where can kids get their best nutrition? And they've given all of our listeners a 15% off code. So it's SFH15, but we'll make sure we link the code and the link to their course in the show notes below, because they're really incredible and they provide such amazing information. So check out that course if you're starting to come up to that point of thinking of starting solids in your baby.
Well, thanks for listening, everyone. We hope you found it helpful, and we wish you all the best in your breast, chest, body, and infant feeding journeys.
Take care.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood, and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.